Hi folks, Dr. Amar Bali here. Welcome to Cancer Healing Vlogs. So the topic here being that what is the number one skill that as a pathologist you want to, that I feel is of value. Now, of course, you cannot just say, okay, this skill is better than the other, because obviously your basic minimum skills as a pathologist to be able to report, you need to be knowing what is required. Like you need to have the fundamental skill. But I feel that there is one skill which comes to my mind that really I found something that matters more than the others a little bit. What is that thing? I think it's the fact that if you can be very confident in your reporting. Now let's understand what I mean by that. What I mean is that not just confident in your report as in, okay, you know what is right, what is wrong, but when you release a report, before you release a report, you make sure that you are 100% sure that whatever is being authorized is to your best understanding correct, and your best understanding should also be with data and with proper understanding, with proper, if histories are required, if the right information about the machines are required, quality control, be it knowing the previous reports. You need to be clear, and unless and until you are 100% sure about a particular report, this is the correct one. Sometimes it may take you a few seconds to understand this is correct, but at times you may need to give it more time. So that's where you are giving it, depending on the priority and the case, you may have to give it more attention. So before you authorize, you are absolutely sure that you are giving a correct report, because as many of our seniors all say, and this is something very true, that as a pathologist, you do 1,000 correct reports, maybe you won't get any appreciation for it other than your salary or your pay. But if you get one wrong report out of those 1,000, it's a big, like a big black mark, or something that you don't ever want to ever happen for your patients and for you as a pathologist, right? So being sure, and oftentimes when we are starting out, we just we just sign off. We're like, okay, fine. When we are like as residents also, or perhaps you may be just a junior consultant, you may not think more than you need to on certain cases. But then there are some cases that require that careful attention. Some cases require a lot of time. Maybe even you need to have a discussion with a few doctors, maybe the treating doctors, or maybe your colleagues. So this is something to certainly I found of value, and I hope it helps you all in some way. All right, stay aware, liberate self, like and subscribe. Cheers.